Hello, I'm Dr. Peter Laniewski, Specialist Plastic Surgeon. Recently, some of my patients have come to see me after travelling to other countries to have a plastic or cosmetic surgery. Often these countries are not as developed as Australia and don't have the same expertise or medical systems that we do. The thought of leaving a first world country to travel to the third world to have an invasive procedure with an implant or prosthetic device, in my mind, is just crazy. And you really are playing Russian roulette with your health. Often the procedures that are performed are inappropriate or are not performed to the same standard. The qualifications of Australian plastic surgeons are second to none and are very highly scrutinised. It is very difficult to become a specialist plastic surgeon in Australia. It takes many years of training. In other countries, the same standards aren't upheld, and you are not to know who is operating on you. You really are placing your life in somebody who you've never met, and you have no recourse or no recall for any action if there are any problems, and your family won't either. So one of the biggest problems that patients don't consider when they travel overseas is that, sure, it might seem cheap at the outset. However, if things don't go to plan, the out-of-pocket costs are going to be significantly higher when you come back home to have these problems rectified. When you go overseas, you're often back in Australia within a few weeks' time, so there's no aftercare, there's no review of results, there's no long-term follow-up. So you're not to know how you're travelling, how your results are going, whether you're recovering as you should be, because there's just no follow-up, and your general practitioner is not really in a position to provide that aftercare for you. So any initial saving you may perceive as being worthwhile really can become quite expensive very quickly.